Question 47, which of the following special tests is most likely positive? So we got a great OMM question here. I love the special test. It's just rote memorization. Plus I like ortho, so why not? A 36-year-old woman reports anterior shoulder pain. Her pain has been progressively worsening since she first noticed it several months ago. She does not recall any inciting factors, so no trauma, most likely. She works at a daycare and is frequently lifting young children. On exam, pain is reproduced when she attempts to flex her arm forward against resistance with the elbow extended and forearm supinated. So we're flexing her arm forward. Yeah, so this is probably referring to shoulder flexion, although they didn't quite specify that. With the elbow extended and forearm supinated. So that is talking about Speed's test. Pulses are 2+ and sensation is intact bilaterally. So again, these special test questions, they're very high yield, but it's just all rote memorization. When you get something like this, there's really not a lot of logic you can do. So definitely need to put these in a flashcard, memorize them. You will get points from this. So again, we had her do Speed's test and that was painful. Speed's test for bicipital tendinopathy. If you're not really sure why, let's draw out the humerus here. So let's say this is the greater tubercle and the lesser tubercle on the medial side and the lateral side. So we're looking at someone's right arm, someone's right humerus, and this is facing the patient. So this is the anterior surface of the humerus. You've got this bicipital groove here where you'll find the biceps tendon, or one of them at least. This is the long head. And this is anterior. You might even be able to feel this on your own humerus if you try externally rotating and internally rotating your humerus with the pads of your fingers right at the top of the humerus, just underneath the clavicle, maybe a couple centimeters inferior to the clavicle. You might feel a little ridge moving under your finger pads as you rotate externally and internally. That's the bicipital groove. And that's where these people feel pain. It's very common to have bicipital tendinopathy concomitantly with rotator cuff disease, but here it doesn't really seem that way. At least they didn't give us any other special tests indicating it. So we just need a special test for the biceps tendon. And that special test is Yergesen. Yergesen is essentially when you attempt to supinate the forearm against resistance. The Yergesen test is when you attempt to pronate the forearm against the patient's resistance. So the patient tries to supinate and you try to pronate them. How does that trigger the biceps? Well, it's because the biceps' primary function is actually forearm supination. It's not elbow flexion. The primary function of the biceps is to supinate the elbow. Elbow flexion is a secondary function of biceps brachii. So again, really just memorize these, make sure they make sense in your brain. Hopefully Yergesen makes a little more sense now, how you do it. How you can do it in real life is you basically just give the patient a handshake and you're going to try to pronate them and tell them to resist you. So correct answer is B.